All the way until 8 o'clock Atlantic Standard Time, and it's a beautiful morning here in Trinidad and Tobago. Good morning to those of you blowing up the Facebook page. I'm seeing you, and I'm going to get to you in a bit. I'm seeing some of you from New York and so on. But right now, we want to talk about what's happening in our sister island of Barbados. Barbados is under curfew from 9 p.m. to 5 a.m. This after an outbreak of cases at the H.M. Dodds prison. In fact, the reopening of schools has been postponed to after January 14th, when the curfew is meant to end. To tell us more about it is head of the PAHO WHO office for Barbados and the Eastern Caribbean countries, Dr. YITADES GEBRE, who joins us live via Zoom. Good morning, Dr. GEBRE.
Good morning, Lisa. Good morning. Thank you for having me.
Can you tell us what the situation is in Barbados at this time?
As you have just indicated in the earlier, Barbados has an increased activities of cases of COVID-19 since the start of the end of the year as a result of an outbreak in the Her Majesty prison. This also was as a result of activities which is related to the Boxing Day bus crawl. Therefore, authorities have mentioned that over 161 cases from the prison have been found positive after testing over 1,000 officers and prisoners and some contacts in that prison.
Mm-hmm. And what does this mean, this uptick for Barbados? Is it that contact tracing is taking place now?
As part of the surveillance activity and the controlling of COVID-19, each case has to be investigated with additional contacts traced. So each of those contacts traced have to be also tested, quarantined. If there would be cases, there would be also isolation. Mm-hmm. So in that regard, the authorities have been working very hard, and they have a systematic surveillance system and contact tracing system, which they have more than thousands of people have been tested for as part of this surveillance. So today and tomorrow, the January the 4th and the 5th, the health officials will be focusing more in doing more contact tracing and identifying if there are any more cases. In addition, they have been working over the weekend, Saturday and Sunday, opening additional polyclinics for testing of individuals who may have been in contact with individuals who now considered to be positive.
Yeah, there is talk about, the search for patient zero. How significant, how important is it to locate patient zero at this time?
Thank you. Yes, indeed. In some quarters, patient zero, or which we epidemiologically or surveillance, we say index case, is to find out who will be the first person who may have been infected and started this outbreak. The importance is, in COVID-19 is that it is transmitted by close contact, sneezing, coughing, and individuals. Therefore, the most important aspect of preventing the spread is that to have a cough etiquette and then spreading contact, reducing space in terms of the individuals who may have been infected. Therefore, what to be done is to as much as possible to practice proper respiratory etiquette and hygiene, so that the spread would be reduced. Therefore, individuals have to wear masks and then to avoid crowding places, confined places. So that's the most important thing, rather than to find out who is the person who started this outbreak. Yeah. We know there will be some asymptomatic people. Therefore, sometimes it's very hard to identify. But with a new knowledge, we'll be able to find who is that person. But yeah, we know what to be done and how to control this outbreak.
Yeah, is this case, this whole situation with this uptick, would this be a case of a super spread, would you believe, in Barbados, or it's too early to determine that?
The COVID-19 virus has been known to be spread in confined spaces where people are crowding, where they are talking to each other in a very close circumstances. Therefore, once we know such events have taken place, the spread would be there. Right. Yes, in a short period of time, they were able to identify over 100 people who may have been in a confined space, the so-called bus crawl, where individuals have been in very close contact over a period of time. So usually it takes about 15 minutes so that people would be considered to be a contact. Therefore, in this particular case, for over few hours, individuals may have been in a very short place, contact may have taken place. Therefore, it is very early to say it is a super spreader or a new virus variant. Just we could say because of people were not wearing masks, people were gathering very closely and not taking the proper precaution, the event may have resulted in a large number of outbreaks at this point in time.
You're also responsible for the Eastern Caribbean countries, and Grenada registered its first death over the weekend, an imported case, I believe. Any update on Grenada and the Eastern Caribbean?
Yes, yesterday we heard that, or we were informed through the media that there was a death, which was officials initially confirmed. However, later on, it was also the officials in that country are investigating whether this death is linked to COVID-19. Therefore, I could not say much about it at this point in time until the officials are confirming if there was a death of COVID-19 related.
Okay, and let's move on to the French Caribbean, which also falls under your purview. Initially, I was very interested in French Guyana because their numbers were rising a bit steadily among all the, French Caribbean territories, and now it's just over 13,000. What's the situation with the French Caribbean territories, as I have you on the line?
Okay, thank you. Again, as you know, one of the countries, the territories in our Eastern Caribbean are the French territories, which may have larger number of outbreaks, community transmission early in this outbreak. They have managed to control and then provide the necessary care for the individuals in all of these territories. As you mentioned, the largest outbreak have been French Guyana. But when we look at the spread in each of these territories, from Martinique to Saint Martin to Saint Barthélemy, each one of them have a similar kind of transmission pattern. People were moving from mainland France, and people also moving from within the countries and also from the other Eastern Caribbean countries, and resulted the outbreak to continue. So overall, there is a stability in the outbreak. The positivity rate is somewhere between less than 5% of the number of tested in each of those countries. Guadeloupe may have the largest outbreak than the French Guyana in terms of per 100,000 population when we look at. So each of those territories, as I mentioned, do have a kind of community transmission, which is stable, and then the authorities are doing very well in terms of controlling the outbreak in each of those countries and providing care.
All right. Well, Dr. GEBRE, it's so wonderful of you to join us this morning to give us a sort of a regional roundup, so to speak. We started in Barbados, went to Grenada, and of course, the French Caribbean territories. I want to thank you very much for joining us this morning. Dr. YITADES GEBRE, head of the PAHO WHO office for Barbados and the Eastern Caribbean countries. Thank you, Dr. GEBRE. And that was Dr. GEBRE there, live from Barbados, giving us some insight and sort of like a regional roundup for this morning on COVID-19.